It's 3:17 a.m., and you wake up suddenly, your heart pounding in your chest, a cold, sweaty shirt clinging to your back, a dull headache in the back of your neck, the kind you've never felt before. You look at the dark ceiling and think, it must just be a nightmare. You turn to the side. You try to go back to sleep. And it's exactly at that moment that many seniors over 60 make the fatal mistake of their lives, because what you just felt might not be insomnia. It might not be anxiety. It might not be getting older. It could be your own body screaming that a silent stroke is forming inside your arteries, and that it could take you down in the next few hours. Researchers at the American Heart Association have discovered something that will scare you. The risk of stroke is 49% higher between 6 in the morning and noon. Almost half of all strokes happen in this deadly window. And the worst part, most could have been prevented. Not with expensive medication, not with surgery, but with 5 simple changes that nobody teaches you if you're over 60. And you sleep any old way, wake up any old way. Pay very close attention for the next few minutes, because I'm going to reveal the 5 silent mistakes that trigger strokes during the night and early morning hours. Mistakes that millions of seniors make every day, without even realizing it. And before we continue, do one thing for me. Subscribe to this channel now and turn on notifications. Because what I'm going to teach you here, your cardiologist will never tell you in a 15-minute consultation. This content can literally save your life, or the life of someone you love. Now answer me in the comments, and be honest with me. Do you wake up in the middle of the night? What time? 2 in the morning? 3? 4? Do you feel palpitations? Headache when you get up? Dizziness? Comment below now. I read all the comments, because understanding your pattern is the first step. And look, this video isn't about diet. It's not about exercise. It's not about new medication. This video is about what happens in the first 2 hours after you open your eyes. And why those 2 hours can be the most dangerous of your entire day. Your cardiologist probably never explained this to you. And it's not because he's a bad professional. It's because the system doesn't allow time. A 15-minute consultation doesn't allow for education. It allows for prescriptions. It allows for test orders. It allows for billing the health insurance company. The pharmaceutical industry doesn't profit from you changing simple habits at home. It profits from you buying pills every month for the rest of your life. And that's why what you're going to learn here is so rare. After 60, your arteries change. They become stiffer, less elastic, more sensitive to any sudden change in pressure. And that's where the danger lies. Let me explain something that few people outside of medicine know. During the night, while you sleep, your blood pressure naturally drops. Doctors call this nocturnal dipping. When you're young, your blood pressure drops between 10% and 20% during sleep. This protects your heart. It gives your circulation a rest. It's like your car's engine idling, cooling down after a long trip. But after 60, this system starts to fail. In many seniors, blood pressure does not drop as it should. Or it drops too low and then rises too quickly. And then comes the part nobody tells you. Around 6 in the morning, even before you open your eyes, your body releases a giant wave of cortisol and adrenaline. Doctors call this a morning storm. It's a hormonal explosion that can make your blood pressure rise 30-40 millimeters of mercury in less than an hour. Imagine your artery after 60, like an old garden hose, dried out by the sun. Tiny invisible cracks in the walls. Extra pressure that a young person can easily handle. In you, can burst. And what you do in that critical window, between 6 in the morning and noon, determines whether this storm will knock you down, or whether you'll emerge unscathed. The next 5 mistakes all happen within that deadly window, and you probably make at least 3 of them every day. Mistake number 1. Getting out of bed too quickly. It seems simple, it seems silly, but listen. Most seniors do exactly the following. The alarm clock rings, or the urge to go to the bathroom hits, and in less than 10 seconds you're already on your feet. You jumped out of bed. You walked quickly down the hall. And that's exactly where one of the biggest triggers for morning strokes lies. What happens to your body in those first 60 seconds after waking up is frightening. When you're lying down, your blood is evenly distributed. When you stand up suddenly, gravity pulls the blood down to your legs, to your internal organs, and your brain is momentarily deprived of enough oxygen. Doctors call this orthostatic hypotension in younger people. the body compensates in seconds. But after 60, this compensation mechanism becomes slow. Sometimes it doesn't work properly, and then the signs appear. You feel dizzy when you stand up. Your vision blurs for a moment. You hold onto the wall. You almost faint. Many patients tell me, "Doctor, I thought it was normal. Just weakness." It's not normal. This is your brain crying for help. This is an open window for a stroke. And guess what's worse? This symptom happens precisely between 6 and 9 in the morning, within the deadly window of increased risk of 49%. A study published in the Journal of Hypertension followed more than 3,000 seniors with high blood pressure. The result, those who suffered from morning orthostatic dizziness had more than double the risk of stroke in the following 5 years. Double. And none of them knew. Nobody had warned them. The solution is simple, free, and I'll teach you at the end of the video. But it involves a 90-second routine before you put your feet on the ground. Write it down. 90 seconds. It could save your life. Now, if you've ever felt that dizziness when standing up, that blurry vision, that "oh, I almost fell" feeling, comment number 1 below. I want to see how many of you go through this and never told anyone. And while you're at it, leave a like on this video, because YouTube only shows this content to other seniors when you engage. It's free. It costs nothing. And it could save the life of your neighbor, your brother, or a friend's husband. Mistake number 2. Drinking ice water right after waking up. Imagine that. You open your eyes, go to the kitchen, open the refrigerator, and grab that pitcher of ice-cold water. You drink a full glass all at once. Oh, refreshing. Wakes you up. Great feeling. Except for your arteries after 60. That's a violent thermal shock. The wellness industry has taught you for years that drinking water upon waking is healthy. And it is. But no one explained the temperature to you. No one explained that ice-cold water, suddenly hitting your esophagus, at the level of your heart, can trigger a reflex called sudden vasoconstriction. In simple terms, your blood vessels, already sensitive from the morning cortisol storm, receive the shock of the cold and constrict even more. Imagine squeezing a garden hose with both hands while the water is flowing. The pressure inside skyrockets. And where does this pressure rise first? In the brain, in the heart, in the weakest arteries. Research in Japanese cardiology, where there are many long-lived seniors, has shown that people over 60 who drink ice water immediately upon waking have significantly higher blood pressure spikes than those who drink room temperature water. This spike, added to the natural morning spike, is the perfect combination for a stroke, and look how insidious it is. Your body doesn't warn you. You don't feel anything immediately. But the damage is happening inside day after day. Millions of seniors do this every morning and have no idea. The solution is absurdly simple. Before going to sleep, leave a glass of water on your bedside table at room temperature. When you wake up, after those first few calm minutes, drink 200 milliliters slowly. No rush, no giant gulps, no ice, no refrigerator. This warm glass, or at room temperature, hydrates you without shocking your arteries. It costs nothing, and it protects your brain. Mistake number 3. And this one is the most taboo of all. Nobody wants to talk about it. But I'm going to talk about it, because it could save your life. Straining in the bathroom first thing in the morning. You know what I'm talking about. That moment when you sit on the toilet and nothing happens. Then you strain, hold your breath, push, and push again. Doctors call this maneuver the Valsalva maneuver, and it is one of the main causes of morning stroke documented in medical literature. When you hold your breath and strain, the pressure inside your chest rises. Your blood pressure can jump 50 millimeters of mercury in a few seconds. Imagine, your blood pressure was 140. You sit on the toilet, strain, and in 5 seconds it's 190. In seconds. And then, one of those small fatty plaques in your artery, which had been quietly there for years, breaks loose. It goes to the brain. Stroke. This isn't my theory. Forensic medicine studies show that an alarming percentage of fatal strokes in seniors happen in the bathroom or minutes after leaving it. And the family finds the person collapsed there. And nobody understands why. Nobody tells you this. This problem is especially serious for men over 60 with prostate problems who strain to urinate. And for women with chronic constipation who need to make an enormous effort to defecate. Combine that with the morning cortisol storm. Combine that with dehydration from 10 hours of sleep. Combine that with stiffened arteries due to age. And you have the perfect recipe for a tragedy. The solution has several parts. First, hydrate yourself at night, not just in the morning. Drink 2 glasses of water about 2 hours before bed. Not at bedtime, otherwise you'll wake up to go to the bathroom. But 2 hours before. This softens everything overnight. Second, increase fiber in your diet. Oatmeal, prunes, papaya, inexpensive things. Third, and this is very important, when you're in the bathroom, never hold your breath. If you need to strain, exhale slowly while you do. Release the air. This prevents a spike in blood pressure. Fourth, consider using a stool under your feet, keeping your knees higher than your hips. This position is physiologically correct for bowel movements and drastically reduces straining. And tell me honestly, do you feel like you have to strain in the bathroom in the morning? Do you hold your breath when you go to the bathroom? Comment below. This is much more common than you imagine, and I want to know how many of you go through this. And if this video has taught you something new so far, leave a like now. The YouTube algorithm needs this signal to show this content to more seniors. You help save a life just by clicking the button. Mistake number 4. Picking up your cell phone before getting out of bed. This is the newest mistake, and perhaps the most underestimated of all. You open your eyes. You reach for it. You grab your phone from the nightstand. You unlock it. And in 3 seconds you're already seeing bad news, messages from a worried child, photos of tragic news stories, WhatsApp audio messages from your brother-in-law, electricity bills to pay. Your brain, which hasn't even finished waking up yet, receives a flood of psychological stress all at once. And here's the problem nobody talks about. This emotional stress, added to the natural hormonal storm of the morning, is a bomb. When you read news that irritates you, or a message that worries you, your body releases even more cortisol and adrenaline, on top of a wave that was already happening. Your blood pressure rises even more. Your heart races. Your arteries, which were already under pressure in the morning, receive a second blow. While still lying in bed. Before even getting out of bed, Stanford researchers have documented that seniors who check their cell phones within the first 5 minutes of waking up experience significantly higher cortisol spikes than those who wait at least half an hour. And remember, high cortisol plus morning plus arteries after 60. That's the combination we tell you to avoid. Big tech companies know this. The companies that make these apps are designed to keep you glued to your phone. They use attention science, dopamine science, addiction science. They don't warn you that this can trigger a stroke in people over 60. Why would they? It's not profitable to warn them. The solution is simple but requires discipline. The first 15 minutes after waking up are screens free. No cell phone, no television, no tablet. Use an old-fashioned desk alarm clock if you need to, one of those battery-operated ones. They cost $15. Put your cell phone in the living room, not the bedroom. When you wake up, breathe slowly. Drink room temperature water. Get up slowly. Only after that, pick up your phone. Those 15 minutes can be the difference between reaching 90 years old with your brain functioning and being in a wheelchair depending on your children. Error number 5. And this one is the most dangerous, the most hidden, and the most anti-system of all. Taking blood pressure medication at the wrong time of day. This will shock you. The vast majority of seniors worldwide take their blood pressure medication in the morning, right after breakfast, out of habit, because the doctor said take it in the morning. But recent studies in the field of chronotherapy, which is the science of when to take medication, have shown something impressive. A massive study published in the European Heart Journal, involving over 19,000 hypertensive patients, showed that taking blood pressure medication at night, before bed, reduced the risk of cardiovascular events including stroke, by almost half. Almost a 50% reduction, just by changing the time, without changing medication, without increasing the dose, without spending a penny more. Why? Because by taking it at night, the medication acts precisely at the time when your blood pressure becomes uncontrolled. During the early morning hours and the dreaded morning storm at 6 o'clock. It protects you at the exact moment a stroke strikes, and then you ask yourself, why hasn't my cardiologist changed my schedule yet? Several reasons. Clinical inertia, which is the doctor's tendency to continue with what has always worked. Lack of time during the consultation to discuss this nuance. Lack of reading the most recent studies. And yes, lack of incentive from the industry, which doesn't profit from changing schedules. It profits from new prescriptions, but pay attention, and this is extremely important. Do not change your schedule on your own. I repeat, do not change it on your own. Some medications need to be taken in the morning for other medical reasons. Diuretics, for example, are usually taken in the morning so you don't wake up in the middle of the night to urinate. What I want you to do is take this question to your doctor. At your next appointment, ask, "Doctor, I read about chronotherapy. Does it make sense for me to change my blood pressure medication to the night?" If he knows about the study, he will talk to you about it. If he doesn't know, at least you planted the seed. The most common medications that benefit from this are ACE inhibitors, angiotensin receptor blockers, and calcium channel blockers. Your prescription probably has one of these names. It doesn't change anything on its own, but ask yourself, and tell me right now, if you take blood pressure medication, comment below what time you take it. Morning? Night? Lunch? I want to see your pattern. And if this video opened your eyes to something important, leave a like now, because this type of information doesn't reach us through official channels. It only reaches us here. Now let's get to the part that will change your life. The 90-second routine that protects your brain every morning. Write it down. Save it. Share it with someone you love. Step 1. Before even opening your eyes completely, lie down for 30 seconds breathing slowly. Inhale through your nose counting to 4. Hold for a moment. Exhale through your mouth counting to 6. Do this about 5 times. This simple act signals to your nervous system that everything is okay and reduces the morning cortisol surge. Step 2. While still lying down, wiggle your fingers and toes for about 20 seconds. Make small circles with your ankles. Squeeze and relax your calves. This slowly activates venous return and prepares your body to stand up without that drop in blood pressure. It's like starting the engine before accelerating. Step 3. Sit slowly on the edge of the bed. Don't get up yet. Stay seated for 30 seconds. Looking straight ahead. Let your blood pressure adjust. This is the most important step of all. This is where you avoid orthostatic hypotension, dizziness, and almost fainting. 30 seconds. Sitting still. Step 4. Now get up slowly and walk slowly to where you left that 200 milliliter glass of room temperature water. Drink slowly, in small sips. This gentle hydration thins the blood, which has become thicker after 8 or 10 hours without drinking anything. Step 5. And this is the hardest for many of you. Do not touch your cell phone for the next 15 minutes. Drink your coffee. Look out the window. Talk to your wife, your husband. Take care of the plants. Do anything but read the news. This mental silence is a gift for your brain. This entire routine costs 0. You don't need to buy an expensive pillow. You don't need to buy supplements. You don't need to pay for consulting. I know many of you have tight budgets. I know some people have to choose between buying medicine and buying food. This routine is for you, for free, forever. And research indicates that it can cut the risk of morning stroke in seniors over 60 in half. By half, the first 20 minutes of your day. Decide whether you'll reach 80, 90 years old with your brain intact, playing dominoes with your grandchildren, remembering their names, telling stories, or whether you'll become a photograph on a shelf with your family crying and saying, "But he was so well yesterday." Every morning is a choice. Every sunrise is a chance. Don't waste that chance by making the 5 mistakes I showed you today. Now answer me honestly below. Which of these 5 mistakes do you make? Getting up too quickly? Cold water? Straining in the bathroom? Cell phone before getting up? Medication at the wrong time? Comment now. You can comment more than one. I read all the comments. And if this video helped you, if you learned at least one new thing today, leave a like. This like helps other seniors like you see this content. It can save a life. It costs nothing. Click now, and there on your screen is the next video I've selected for you. Click on it now, because I'm going to reveal 4 morning symptoms that honest cardiologists consider more serious than they seem. Symptoms that you probably feel and ignore. Symptoms that could be the last warning before a serious event. This next video is a direct continuation of what you just saw. Click now before you forget. Take care of your brain today, because tomorrow, it might be too late.